My name is John.
You had an operation.
I did on September 1st.
What was the surgery?
I believe a unimedial compartmental, which is basically partial knee replacement.
That's right, partial knee replacement, and we used a robot.
Yes.
The Corey robot, the newest robot. Did you stay in the hospital?
No, I didn't. I had a 7 a.m. call.
Yes.
I was in post-op at 2:33 in the afternoon, and I was home by 7:30 that night.
What was it like for you being home the first night and the first day?
Crutches up 12 stairs, and
You had stairs.
yeah,
So you went home. Now, how did you get up the stairs?
by myself on crutches.
Uh-huh.
A couple of days, but less than 2 days,
Uh-huh.
I put the crutches down and was getting around the apartment okay without them.
Now, pain medication, what was the heart and soul, or what was the most of, or that worked the
the only
best?
pain meds that I was prescribed was the Norco.
Yes?
After the first week, really didn't need it. Honestly, yeah. After a week, maybe even less than that, it didn't need it.
So now you're about 6 weeks out. You're not taking any Norco, no opioids.
No,
What are the activities that you would love to return to?
hiking was a lot of uphill strain on the knee, which was giving me pain, so I couldn't do that. I'd love to be able to play softball again, even though I probably won't, but to know that I could
Yes,
swing a back, twist, turn, pivot on my knee
yes.
is great to know. But simply, I just need to sweat. I just
Yes.
need to get in the gym even when they reopen, and get on the elliptical and
Yes.
jam and push and pull and do my weights and just be able to work out again.
So you missed the intensity.
I do.
Good. Well, I believe you're going to get back to those things.
Thanks to you.
I absolutely believe that you're going to get back to, for sure, hiking. And if you want to, you can return to baseball.